It's Time Warner Cable's Local Edition. I'm Brad Pomerance. I'm glad you're with us today. Our guest, Curren Price, member of the California State Senate. And whatever you think about the Affordable Health Care Act, we'll talk about that momentarily, we do know that there are still disparities with regard to health care, be it economically, be it racially. What do you know about those health care disparities?
Well, we know that the disparities exist primarily in communities of color,
right.
And those areas certainly represented by members of the California Legislative Black Caucus. And so we've been focusing on really trying to work in collaboration with not just healthcare organizations, but community-based organizations, the churches, et cetera, talking about issues, talking about concerns, trying to identify what we can do proactively to prevent some of these issues, and how we need to be working closer with the system to make sure that we're getting the kinds of services.
And when you think about communities of color, there are certain diseases that seem to be just relentless. You think about diabetes, you think about heart disease. I mean, especially in African Americans, the diabetes rates, the prostate cancer rates, just much higher, and it's heartbreaking.
Right,
and the challenge becomes many of those people of color are not able to get health insurance.
Yes, well, absolutely. A lot of it is preventive. It can be addressed with preventive measures, and not having health insurance, not having a way to get checked up regularly and adequately, it can be a real disadvantage.
But here's what's interesting. As of our taping today, we don't know what the Supreme Court is going to do with the Affordable Health Care Act. But what we do know is that California, be it under Governor Schwarzenegger or under Governor Brown, has been implementing the Affordable Health Care Act.
Absolutely.
And that will stick around.
It will stick around, and there's certainly a commitment, I think, in the legislature that occur as well. And so you have that rare situation where you have the legislative branch and the executive branch in one accord. And you're right, it has gone back to Governor Schwarzenegger. California's been a leader in implementing the health care reforms that are a part of the ACA. I
want to ask you about an initiative that looks like it will be on the ballot, dealing with health insurance. As you know, maybe 20 years ago, the voters of California passed Proposition 103, dealing with the regulation of auto insurance. And it would cause the creation of an insurance commissioner. Dave Jones is the insurance commissioner now. There is an initiative that would give the insurance commissioner more power over health insurance. He has some power now, but not as much as he has over auto insurance. Do you think it's time for the insurance commissioner to take the reins on the entire health insurance system?
Well, I think it sort of is time to have that discussion.
Okay.
Let's look at it. Certainly, we know health care is much more complex. The administration of it is going to be much more detailed. Perhaps there is a role for the commissioner to play. I don't know what that is or is not. But it certainly is worth a discussion, and I'm willing to have that.
I want to talk to you about the Legislative Black Caucus. It is a fact that the demography of California is shifting. And so if you look at the numbers of the Black Caucus, historically, they seem to be going down a bit. Is that of concern, or is it basically, anyone can represent any community?
Well, we certainly are sensitive to the realities, demographic realities, but I think the record is showing that African Americans are able to lead in communities where there are not a majority of African Americans. In fact, in the current caucus, I dare say there may be only one or two members who have predominantly African American districts.
I believe you're my senator, and I live in an area that is not majority African American.
That's correct.
And so there's no doubt.
But the exciting thing is we have an opportunity to increase our numbers this year.
I was going to ask.
We currently are at 8. We could go to 9, and very excited about the possibility of having a member in the legislature, African American, for the first time, south of Los Angeles.
Really? What seat?
We've got a candidate in the 79th, Dr. Shirley Weber in San Diego.
Well, good luck on that.
So,
good luck on that.
She's in the runoff, and we're pulling for her.
His name is Curren Price. My name is Brad Pomerance. Thank you so much for watching Time Warner Cable's Local Edition.